Welcome, welcome, everyone. I'm so glad you're here. I'm really excited to be coming together tonight. And speaking of coming together to show how big, powerful, and spectacular our event is and our movement is, and we are together, let's put our first names and our city in the chat. So, first names and cities in the chat. Let's see each other. Let's look at each other. Let's look at all the states coming in and let's put them in as we're coming in so we give people time to come on and we can celebrate each other. So let's see first names and states in the chat. I see California, Tennessee, Wisconsin, Connecticut, Nevada. They're going by so fast. New York City, another Wisconsin, Seattle. That's where I am. I see Pennsylvania, Oregon, Florida. Hello, Florida, Atlanta, Georgia, Indiana, Illinois, Pennsylvania. Look at us all over the country. Michigan. Yay. Hello, Michigan. They're going by so fast if people could read them. Look at that. New Jersey. We have almost every state. I think I've seen almost every state fly by. So thanks for coming on, putting your first name and your city and state, or just your first name and the state in the chat. Utah, hello, welcome. See another Washington state. Hello, Wenatchee. Hearts going out to you with the floods. I see lots of Louisiana. So thanks so much for coming on. Thanks for putting your first name and your city and state in the chat. Ohio. Seriously, I think we have all the states covered. We're excited that you're here today. And so are so thankful to be able to be here for one another in this really, really, really difficult time for our nation. So thanks again for putting your city and state in the chat and maybe your first name too. We've got Texas. Woohoo. Hello, Texas. And more. Really, pretty much the whole country is on. So thank you for being here to represent the whole country. I am going to start us off, and I'm going to start us off with our interpreter. Hello, we have an interpreter of awesome. We have Murtado, and he's going to share interpretation instructions right now.
Thank you, Christine, and thank you everyone for being here and for having us. I'm going to make an announcement in Spanish to introduce Spanish interpretation. All of our meetings have a Spanish interpretation, so please do let everybody know that they can come to this meeting and enjoy them in Spanish as well. Bueno, muy bienvenidas a todas por venir a esta reunión. Para conectarse a la interpretación está súper fácil. Hacen un clic en la pantalla de su celular. Cuando les salga la opción de más, van ahí, le ponen interpretación del idioma, español y terminado para que se active esa función. De nuevo, clic en la pantalla, 3 punticos, más, interpretación español y activado o terminado para que se active esa función. Si se conectan desde una compu, es más facilito, hacen clic en el globito y ponen español. De esta manera pueden disfrutar de esta fantástica reunión. ¿Ok? That's all for me. Back to you, Kristen.
Thank you so much. Okay, if you just came on and you haven't heard, please put your first name and your city and state, or just your first name and your state in the chat so we can see how powerful we are together. I think we've had all 50 states check in, so thanks so much for checking in. As we're going through this evening, due to the high volume of RSVPs, we're doing a webinar style. That means that we are so excited when you use the chat. Also, we love it when you give us a heart or one of those beautiful like confetti things. Can we see some hearts and some confettis? To the speakers who are talking to tell them we're with you. So we can do the hearts and the confettis for and any other emoji that you have. Ooh, I see a thumbs up. Love that too. Any emoji that you're feeling, feel free to use it either in the emoji function or in the chat or wherever. We also have a Q&A function that you'll find at the bottom of your screen, and you can use that Q&A function. We'll try to get as many questions at the end as possible. And so that's where we are. Speaking of where we are, we want to thank Jada, Catalina, Geronimo, Murtado, and the other interpreters and the Moms Rising team, as well as our amazing speakers for being here with us tonight and making tonight possible. We also want to thank you. Hello, you. Let's give a round of applause to you. Come on, let's have some hearts for you for taking time to come on and help save healthcare. So thank you to you for being on. Thank you, thank you, thank you. And tonight we're going to have Representative Lauren Underwood, Marilyn Cabrera, Sylvia Zenteno, and we're going to discuss healthcare and how to take action. So thanks so much. So I'm going to start officially. Happy almost New Year. It's been a tough year, and now the countdown is on as we prepare to close out 2025. So we're coming together to go into 2026 informed, empowered, and importantly, fired up to keep pushing for change, especially as it pertains to the fight to protect our healthcare. We've been hearing a lot of questions from our members about what is going on with the healthcare fights that people are seeing in the headlines, and there is so much to discuss. So, in summary, state of play, where are we? Republican leaders in Congress and Donald Trump recently pushed through a major spending bill that cut over $1 trillion, yes, with a T, from Medicaid. Medicaid covers about 50% of all births. It covers a lot of kids, a lot of elders. It covers a lot of our health care. And on top of that, Republican leaders in Congress are failing to extend the Enhanced Affordable Care Act, ACA, tax credits that millions of people need to keep their coverage affordable. Without those enhanced tax credits in place, healthcare costs could go up more than 70%. Let's have a boo. Does anybody have any down faces, unhappy faces, down sort of thumbs down, all of that? Yes. So we're taking our anger and we're turning it into energy and action. We're taking our disappointment and we're turning it into change. Because one thing we know, if they can break it, we can fix it. We can reverse these cuts. We also can help to try to make sure that the Enhanced Affordable Care Act tax credits cuts don't happen. So we're coming together because there are signs of hope, people. There are signs of hope. I want to share one. Just this week, we had all of the Democratic members of Congress who have long been fighting for health care rise up to expand the enhanced ACA tax credits, or to extend them rather. And there has not been any Republicans who have been joining in with them. There aren't enough Democratic votes to pass it on their own without Republicans. But this week, in areas where Moms Rising members have been calling, they've been active, they've been sharing their story on the ground, we got 4 Republican House members stepping forward to help the Democrats too, to help make there be actually a majority to help protect health care. That's a sign of hope. So I want to have some hearts for some signs of hope. Let's have some hearts for some signs of hope. Let's use those emojis. And tonight we're grateful to be joined by champion Representative Lauren Underwood, as well as by additional folks who you just heard me share. And I'm so excited to join right now with Representative Lauren Underwood. Lauren Underwood serves Illinois' 14th congressional district. She was first sworn into Congress in 2019. She's the first woman, first person of color, and first millennial to represent her community in Congress. She's this rock star. She's a registered nurse and a co-founder and co-chair of the Black Maternal Health Caucus, which addresses America's Black maternal health crisis in Congress and advances policy solutions to improve maternal health outcomes and end disparities. Representative Underwood is co-chair of the House Democratic Policy and Communications Committee, and she serves on the House Committee on Appropriations. She is fantastic. So without further ado, let's hear from U.S. Representative Lauren Underwood.
Hi, everybody. I'm Congresswoman Lauren Underwood, and I have the honor of representing Illinois' 14th District in the U.S. House of Representatives. I want to start by thanking all of you for everything you do for your communities. Moms, parents, grandparents, and caregivers, you are the schedulers, the advocates, the ones who notice when something isn't right, and you make sure your loved ones get the care they need. Your voices matter. And right now, they matter more than ever because we are facing a healthcare crisis that is impacting families and caregivers across the country. In just 2 weeks, the Affordable Care Act tax credits that help millions of Americans afford their premiums will expire. If Congress fails to act, more than 20 million Americans will be forced to pay, on average, twice as much for the very same coverage that they have today. That is a direct hit to families who are already struggling with the rising cost of living under administration that thinks affordability is a joke. Allowing the enhanced ACA tax credits to expire would be incredibly irresponsible because we know that they work. Thanks to the ACA, A record number of Americans are insured. Insurance companies can no longer discriminate against people with pre-existing conditions, people like me. Plans are required to cover essential health benefits like maternity care, prescription drugs, mental health care, and substance use disorder treatment. And the premium tax credits ensure this coverage is within reach for millions of Americans who would otherwise go without care. These life-saving, life-changing tax credits come from my legislation, the Healthcare Affordability Act. And for months, House Democrats have been calling on Republicans to make these savings permanent. So let's talk about what's really at stake here. If Republicans stick to their plan to let these tax credits expire, millions of people will see their costs increase overnight. Right now, the Affordable Care Act ensures that no family has to spend more than 8.5% of their income on health insurance premiums. That protection is exactly what keeps coverage affordable for millions of working families. But according to the Congressional Budget Office, about 4 million Americans would become entirely uninsured if these tax credits expire, while millions more would be forced to pay higher premiums for worse coverage. For example, a typical family of four making $130,000 a year will see their annual premium increase nearly $13,000. That is simply unaffordable, especially at a time when families are already paying more for essentials due to President Trump's tariffs and other bad policies. And sadly, we know exactly what happens when coverage becomes unaffordable. People skip doctor visits. There's a delay in care when there's a problem. They ration prescriptions. Parents put their own health last so they can take care of their kids. Caregivers push through pain and illness because they feel like they have no other option. Families will be forced to make a choice between their mortgage or rent payment or a doctor's visit, between taking a second or even a third job or spending more time at home with their kids. These are impossible choices nobody should have to make. But that's the reality many families will face if these tax credits expire. We already know that most Americans cannot afford an unexpected $500 medical bill. Now imagine what happens when a broken leg costs $7,500, or when a chronic condition goes unmanaged because copays are too high. This is quite literally life and death for people. That's why House Democrats have been fighting for months to extend these tax credits and protect families. In fact, every House Democrat has signed a discharge petition for my bill to extend these credits for 3 years. And now 4 Republicans have signed on as well, thanks to public pressure from folks like you. The discharge petition proves that we have the votes to pass my bill, and now Speaker Johnson needs to do the right thing for the American people and bring it to the floor now. No more delays. It is shameful that he is sending members of Congress home for the holidays without holding a vote on this legislation. But here's the good news. You have power in this fight. Moms and caregivers have always been the backbone of this country. And when you speak up, Congress listens. Call your representatives, especially if you live in a Republican district. Tell them what affordable health care means for your family. Tell them you expect them to extend the ACA tax credits now, because health care should be a right for every family, not an unaffordable luxury for the wealthy. Now is the time to use your voice, use your power, and stand up for what's right. I'm going to keep fighting here in Congress, and I am so grateful to have you in this fight with me. Thank you for all that you do. Happy holidays, and take good care.
Let's give her some hearts. Let's give her some of those sparkly confettis. Let's give some amazing, amazing good vibes, because we have so many people in Congress who are fighting for us, and Representative Underwood is such a big champion. Now, one of the things she said is remember to call your members of Congress and tell them to get moving on health care. So let's all of us remember to do that. We heard it directly from people who know, actual members of Congress, and remind at least 3 friends to do the same thing. Next up, it is my great honor to introduce Marilyn Cabrera. She serves as the Federal Policy and Advocacy Manager for Healthcare at the Young Invincibles. She's previously held several roles within the U.S. Department of Health and Human Services, and she served as policy advisor within the immediate office of the Secretary, where she also focused on immigrant and refugee health, housing, and addressing the needs of older adults. Additionally, she served as the Senior Equity Coordinator within the Office of the Assistant Secretary for Planning and Evaluation. She's also served as a policy advisor within the Office of Refugee Resettlement. Can we say rock star? Marilyn's prior work focused on addressing the social determinants of health through adoption and implementation of effective evidence-based policies. Yes, please. Welcome, welcome, welcome. Marilyn, I pass to you. Let's give her some hearts as she enters. Woo! Welcome, Marilyn.
Thank you so much, Kristen, for that very, very warm introduction. I do have a set of slides, so wanted to know if I need special permissions to share them or, oh, perfect. You all are ahead of the game. So thank you so much, Kristen. Welcome, everyone. Thank you all so much for joining today. As Kristen said, my name is Marilyn Cabrera. I am the Federal Policy and Advocacy Manager for Health with Young Invincibles. Next slide, please. So just a little bit about Young Invincibles. We are a national nonprofit organization. We are committed to elevating the voices of young adults in the political process and expanding economic opportunity for 18 to 34-year-olds. Next slide, please. So some of our core policy areas that we focus on are higher education. We work on making higher education more affordable. My portfolio is more focused on healthcare. So I'm focused on healthcare affordability, mental health access, and reproductive healthcare. We also do a lot of work in workforce development. So ensuring that we're able to expand, protect career pathways for young adults. And then we also have civic engagement, which is a core tenet that runs through all of our work in all of our policy areas. Next slide. So as you heard from Kristen and Representative Underwood, there was a lot that happened in the federal health policy space. So I'm going to just give a little bit of a snapshot on what we experienced with the federal government shutdown in October and part of November, and then kind of recap where we are now and what to expect going into 2026. Next slide. Okay, so I'm sure everyone remembers the federal government shutdown. How did we even get there? So if you don't already know, every year Congress must agree on a set of bills that fund the government for the next fiscal year, which starts October 1st. This year in September, a spending bill was passed in the House. However, once it moved to the Senate, it was short the 60 votes it needed to pass. Senate Republicans and Democrats could not agree to pass a bill to fund the government past October. So once September 30th hit, we saw funding from the previous federal budget expire, resulting in a government shutdown starting October 1st. The main reason why the government was shut down was because Senate negotiations were gridlocked over the Affordable Care Act enhanced premium tax credits. These tax credits, as you know, are increased financial assistance for people who get their health insurance on the ACA marketplace. So, for those folks that don't get their insurance through their job, their school, their spouse, or folks who are not on their parents' plan, you can log on to healthcare.gov or a state-specific website to shop for health insurance. These specific tax credits were introduced in 2021 to help offset the cost of insurance during COVID. There were specific eligibility requirements, but overall, we know that these credits helped more people gain health insurance coverage by making it more affordable. Now these credits are set to expire at the end of this year unless Congress passes a bill to extend them. And we already know what will happen if these tax credits expire. We know that less tax credits means less affordable health insurance options. Less affordability means people may decide not to buy health insurance at all because they simply can't afford it. And then that will lead to more uninsured people across the country. Today, across the country, we are already seeing increases in the price of health plans as people expect to lose their tax credits. So we're in a really tough spot knowing that these tax credits are set to expire. Next slide, please. So that was the beginning of the shutdown. Lots happened in November as senators worked to negotiate to reopen the government. So this was the longest shutdown in US history, with healthcare, specifically the ACA tax credits, being at the center of the fight. On one hand, we had Senate Democrats who said they would not support reopening the government unless the bill to fund the government included an extension of the tax credits. So we saw their messaging really focused on wanting to extend the tax credits to keep healthcare affordable. And then we had Senate Republicans who said they wanted to focus first on reopening the government, and then they can talk about the tax credits once the government was open. So a reminder, Republicans hold the majority in both the Senate and the House, so any deal would need both Republican and Democrat support. So as part of the deal to reopen the government, we had Senate Majority Leader John Thune, Republican of South Dakota. He committed to Democratic senators that they could hold a vote in December on legislation to extend the tax credits. So this agreement is how Republicans were able to get enough support from Democratic senators to open the government. The funding bill that was passed in November funds the government through January 2026. It includes funding for some programs like SNAP, but of course, it did not include an extension of the tax credits. So to summarize, Democratic senators said they would not support funding a bill for the government unless it included an extension of the tax credits. We shut down the government for 43 days. Republican senators said they would promise to hold a vote on the tax credits if they got enough Democratic support, and then the government reopened. So all of that brings us to December. So next slide, please. So here we are in December. We're running out of time to extend the tax credits before they expire in 2 weeks. So again, back in November, as part of the deal to reopen the government, Senate Republicans said, hey, we'll let Democrats hold the vote on the tax credits. And that vote took place last week. Senate Democrats had proposed a bill that said they want to extend the tax credits for 3 years, no changes to the current credits, just the clean extensions. And then on the Senate Republican side, they proposed an alternative bill that would let tax credits expire and redirect funds to health savings accounts. And while that sounds nice, we know that health savings accounts or access to health savings accounts don't actually do much to make health insurance more affordable. So in the end, neither proposal had enough support to pass, and so both bills failed to pass the Senate last week. Next slide, please. So this week, all eyes were on the House. There were several healthcare bills being proposed to address the expiring tax credits after the failed Senate vote. So we had House Democrats proposing extending the tax credits for 3 years, very similar to what we saw on the Senate side. And then we had House Republicans who had a few different proposals floating around, but those proposals were mostly focused on increasing other health insurance options rather than extending the tax credits. So, some additional context, we saw some moderate Republican members who were working with Democrats to come up with a bipartisan fix to extend the tax credits. In the end, House Republicans decided to not focus on those bipartisan bills, and instead, they ended up moving forward with a more conservative proposal that did not include an extension of those tax credits. And again, they focused more on expanding health insurance options that, again, would not address affordability for people. So I want to note that yesterday, two big things happened in the House. One, a group of moderate Republican members ended up siding with Democrats to force a vote on the tax credits. So they're saying, hey, they're focused on healthcare affordability for their constituents. They want to see a fix. Since their bipartisan bills were not prioritized for a vote, they ended up siding with Democrats. The second thing that happened was the House voted to pass the more conservative Republican plan that does not extend the tax credits. This bill still needs to pass the Senate, and looks like there's not going to be a lot of support for that. So TBD on what will happen once it arrives in the Senate. Next slide, please. Okay, so lots of doom and gloom. So what happens next? So without a fix from the Senate or the House to extend the tax credits, we fully expect that those tax credits are going to expire at the end of the month. We anticipate that without those tax credits, the price of health insurance will increase, and some people simply are just not going to be able to afford it. Also, looking into January 2026, again, we saw enough House Republicans join with Democrats yesterday to vote on a proposal to extend the tax credits. So, even though those credits are set to expire in a couple of weeks, the fight to extend them will continue next month. So, we expect that vote to take place in early January and that fight to continue. So, that's where you all come in. There's still time to kind of push and elevate this issue for folks on the Hill to make sure that they know this is a priority for the American people. The last thing is a reminder that the funding bill was passed in November to reopen the government, but that only funds the government until the end of January. So you can fully expect to see more chatter in Congress related to funding government agencies. Next slide. So I did want to just pause and say, there's still more that you can do. I did want to say that open enrollment is still happening. We have until January 15th. So please go ahead and check your options on healthcare.gov. There's still an opportunity to find comprehensive health coverage on the marketplace. Just because these tax credits are expiring, I want folks to still take a moment to check their coverage options, see if there's something that works for you. Perhaps there's other forms of financial assistance that that you qualify for. So please, I don't want this to just be a doom and gloom takeaway. Please go ahead and still look at healthcare.gov before January 15th to check your options. So with that, I just want to say thank you all for your time, and I'll go ahead and drop some resources in the chat. Thank you so much.
Let's give Marilyn some hearts, some confetti, some rounds of applause. Thank you for all you do. Thank you for being here. Thank you for persisting every single day. Next up, we have an important guest as well. We've had two important guests. Guess what? We have three. It's a trifecta of awesome. We have Sylvia Zenteno. She is coming on as a survivor, activist, a proud Latino, and an expert in national gender-based violence prevention and response. She's worked with multiple federal, state, private, and nonprofit groups to improve their response to violent crimes. Her work is rooted in improving access to gender equity resources and gender-based violence prevention. I'm so thrilled that you're here. You're Director of Movement Partnerships at Planned Parenthood Federation of America and the Action Fund. So welcome to Sylvia. Let's give her some hearts, some round of applause. Woo, welcome.
Thanks so much, Kristen. Hi, everyone. It's so great to be with you tonight on this call. As Kristen mentioned, my name is Sylvia Zenteno. My pronouns are she, her, and ella. My goal tonight is really to connect the amazing healthcare information that Marilyn shared to your reproductive rights and access to reproductive care at Planned Parenthood. So I want to begin by discussing how HR 1, or the big beautiful bill, I would call it the big ugly bill, impacts patient access to healthcare at Planned Parenthood. So in the spring, Congress used the big ugly bill, I'm going to say, to intend to defund Planned Parenthood for 1 year. How? So President Trump and congressional Republicans law defunding Planned Parenthood seeks to block 1.1 million patients from using their Medicaid insurance at Planned Parenthood health centers across the country. Patients that are most in need of affordable care will increasingly face an impossible choice. Scramble to pay for essential care like cancer screenings and STI testing, navigate a worsening, chaotic healthcare system to find another provider, or to just go without care entirely. So that is where we're at. So what is it that has happened to Planned Parenthood health centers over the last couple of months. There's been a lot going on. So the Trump administration and its backers in Congress intended to defund Planned Parenthood because they want to shut down health centers and block patients from getting health care. Our local organizations have shielded the overwhelming majority of patients who use Medicaid from the harm of this cruel law so far. So they have really stepped up. Tens of thousands of patients who went to Planned Parenthood health centers for care in September received the care that they needed from their trusted Planned Parenthood provider at no cost to them. In September 2025, when the defund provision became enforceable, Planned Parenthood health centers provided more than 100,000 visits for patients who use Medicaid, covering about 45 million in care at no cost to patients. However, these efforts to absorb costs are not sustainable, right? It's a lot of money. And the consequences for patients will worsen over time. Several states have made public commitments to provide emergency funding to ensure that patients who use Medicaid can continue to get their care at Planned Parenthood health centers. The public commitment total the public commitments total $200 million to date, leaving a gap of hundreds of millions of dollars still. So more is needed. Certain states can't fill the massive hole left due to federal cuts by the Trump administration, or completely solve the worsening public health crisis that we've had in a long time. Despite facing immense financial strain due to our frayed and very underfunded public health system and compounding political attacks, here at Planned Parenthood, we are trying to stay unwavering in our commitment to ensure access to affordable care for all people, no matter where you live in the country. And also how much you make. So Planned Parenthood has taken the Trump administration to court to protect patients and preserve the right to access high quality care from Planned Parenthood health centers. Last month, the U.S. Court of Appeals for the First Circuit heard oral arguments in the case where we once again made clear that the harm defunding Planned Parenthood will cause to patients and our public health system. Defunding Planned Parenthood has been shown to worsen health outcomes. It raises costs. It weakens state health systems as well. As an example, defunding has pushed women with low incomes, people of color, and young adults out of care, widening inequalities, and more than half of Planned Parenthood's patients rely on Medicaid. So nearly half of them identify as people of color as well. Trying to block these patients from using their insurance at Planned Parenthood health centers cuts care to those that already are at a loss. And it won't be possible for us to absorb that loss. Research also shows that other providers cannot easily replace Planned Parenthood health centers either. So ultimately, this leaves the patients without care. And without our health centers, federally qualified health centers offering birth control would have to increase their capacity by 56% to provide these services, or an additional 1 million birth control patients. All of this is going on while the Affordable Care Act tax credits are set to expire, as mentioned, at the end of this year. Without an extension, the people who rely on the ACA tax credits to buy health insurance will see their premiums skyrocket, causing them to delay enrollment or become uninsured. Congressional Republicans are using their demands for new abortion coverage restrictions in these time-sensitive negotiations as a smokescreen to hide the lack of interest in affordable and accessible health care. So you may be wondering, how can we take action? So first, we can educate ourselves in our communities. Um, we can educate ourselves about the impacts of HR1, the big ugly bill, for example. And I have some information that I can drop in the chat, both in English and in Spanish. We also have two new incredible reports that show the wide reaching harm of defunding Planned Parenthood. The first report shows data from Planned Parenthood health centers, and the second report includes all the research that healthcare organizations and universities have done on this policy in states like Texas and Iowa. The research is very obviously clear. When Planned Parenthood health centers are removed from public health programs, public health suffers. It's also going to force families, states, taxpayers to foot the bill for very basic care that should be covered. So, next, Congress needs to reject any attempts to ban healthcare coverage for abortion. Members of Congress have to hear from all of us right now. Please see our call to action, which I'll put in the chat as well, and our click to call. Share it with your family, with your friends. We know Moms Rising has their advocacy tools as well, so please use whichever link enables you to call your member of Congress and truly just urge them to fight for healthcare and protect abortion access. Finally, share your Planned Parenthood story if you have one. Let us know how Planned Parenthood has impacted you and your family. Those stories are extremely meaningful and they go a long way. So thank you. I will again put those in the chat and I will pass it back to Kristen.
Thank you so much. Let's give some hearts. Let's give some confetti. Let's give some virtual round of applause and lots of hugs. This is terrible what's happening, but I just want to thank everybody for being on, and I want to thank our speakers for fighting every day and the Moms Rising team for fighting every day, because here's something that's important that was threaded through all of everything that our speakers said. What is broken can be fixed. If the funding was cut, we can restore it. So we are not giving up, not now, not next month, not the month after that, and even not the months and years after that, until we restore the cuts, both to Medicaid, to the ACA, and until we make sure Planned Parenthood is fully funded. Hello, Planned Parenthood is an essential part of our healthcare infrastructure in the United States of America. There are receipts, people, receipts. Like 1 in 3 people in America have been to a Planned Parenthood at some point for healthcare. We need to make sure we have a healthcare system. So we have some actions along the way that we'll be putting in the chat right now, and I'm going to go over them in a second. But there's also some questions that went into the questions component of this Zoom that I just want to raise with our experts, Marilyn and Sylvia. So we have a question, and they're really hard questions because I know a lot of these questions we don't know the answer to yet. One of the questions is, I have Medicare and Medi-Cal. Can you kind of look into future and share what will happen to me or what could happen to me? Marilyn, do you want to go first?
Sure, that is a hard question. So I know I'm assuming Medi-Cal's is specific to California. So I think as everyone has spoken, we have the one big beautiful bill, or the one big ugly bill that passed significant Medicaid cuts, and so unfortunately we are going to see the effects of those cuts take place. And so I'm also aware that California is a place where, they're trying to increase support for folks who are on Medi-Cal and who are, experiencing just or who are in need of medical services. So I don't have a crystal ball, unfortunately, but I'm sure that I know that at Young Invincibles, and I'm sure that at Moms Rising and at Planned Parenthood, that we will continue to be fighting for you and folks who are on Medicaid and on Medicare to continue to get the services that you need. And so I think that's all that I can say for now, but I'm not sure if others on the call want to chime in or who have a crystal ball and can say more there.
Sylvia, do you want to add anything?
I unfortunately don't have a crystal ball, but I will echo all of that. I will also say that our affiliates in California have been doing a really amazing job with fundraising. And so the services are still available and they will still be available. So, the care is still there. For now, it's still there.
And then the other thing with the crystal ball part of this whole situation is that when the big, awful, terrible bill passed a couple months ago, a lot of the implementation components were delayed until later in 2026 and actually even later. That's both good news and bad news. The good news is it's delayed long enough that we have time to keep fighting, keep marching, keep asking for members of Congress to reverse the cuts. The bad news is that we have these cuts looming on the horizon and we don't know how they'll ultimately be implemented. Some of what is going to happen, as you heard, is that with Medicare being cut, some of the states are going to have to increase revenue and are going to try to fill in the gaps. You just heard Sylvia sharing that Planned Parenthood is trying to fill in the gaps. But what that means is often there'll be rippling negative impacts because when you fill in the gaps, something else gets underfunded, like childcare or roads or something like that. And so the basic answer is we don't know what's going to happen. We wish we did. Honestly, we wish we weren't in this situation at all. I wish Republican leadership and Donald Trump did not cut Medicaid. But we will continue fighting to make sure people have access to the health care they need, no matter where they need it. Speaking of which, another question is really important. Birth control. Hello, birth control has been under increasing attack by Republican leaders. What is happening? Birth control is so important. Having the ability to decide if you're going to have children, and if so, how many and when, is critical to the autonomy and the freedom of people anywhere. And so, Sylvia, what's happening with birth control, and how can people get access to birth control if they happen to be in an area where it's really limited?
That's a really great question. So, all of your Planned Parenthood clinics, we have had some closures, but we will still provide free birth control. If you go to PlannedParenthood.org, you can find your closest clinic. And the reality is, we have had a lot of closures in many states. However, clinics that are still open will provide that to you.
It's important. Did you want to add anything, Marilyn?
No, I think Sylvia, your response is perfect. Thank you.
Thank you. We have another really important question. What are some good ways for disabled patients, parents, and people to be activists? Do you have any tips? Marilyn, do you want to go first?
Yeah, absolutely. I think my main thing is always stay vocal, stay engaged. If you have the opportunity to call your member of Congress, I like to put them in my phone as kind of a favorite contact, and so share your story as needed. If you want to take a quick 5 minutes to, talk about why, healthcare affordability or whatever, issue is important to you, leave folks a message. I I will speak for myself. I used to be a Hill intern, and so I used to actually answer those phone calls and talk to folks all the time, talk to constituents. Those calls do matter. They do get logged, and they do make their way to your member of Congress and to your senator. I'm sure that Kristen has ways that you can get involved through Moms Rising, but I know that at Young Invincibles, we also have many actions that you can take. We are very big on storytelling. So I already dropped it in the chat, but can drop it again. We are committed to elevating diverse voices. And so if you want to share your story about whether it's healthcare affordability or other things that are important to you as a disabled patient, as a parent, or just other things that you're passionate about, we will take those stories and are happy to elevate those in whatever way that we can.
Thank you so much. Anybody want to add anything else?
I will just add, same here. The pandemic brought a lot of not so great things. However, we have now a vast amount of virtual options for engaging. So please feel free to engage in whatever way you feel comfortable. We try to have both in-person and virtual options. And I also shared our click to call, so feel free to use that as well.
Please do. Please do all the actions, you all. Everybody doing all the actions is really important. There is no limit on the number of actions you can take. We're really excited for you to take actions. Last question, and this is an important question. Sylvia, to you first. What is bringing you hope? Even though these headlines are disastrous, the news is dismal, what's bringing you hope?
I will say that something that is bringing me hope has been seeing communities come together. I think as we face some of these challenges on the policy side of things, neighbors have really come together to provide support for each other. And I have just really loved seeing that community effort. I've even seen it in my own.
That's a great answer. Thank you. Marilyn.
Yeah, absolutely. I think similar to Sylvia, community. So community in just in my own space, connecting with family, connecting with friends. But in the policy space, seeing what gives me hope is seeing some sense of bipartisanship. I think the fact that healthcare affordability and this larger affordability discussion has been, really propped up into the mainstream is really uh, something to look or something to look forward to. I think this is a time where we can actually come together and say, you know what, like this is not working for us. Maybe this is a place where folks can actually come together and say, we need some change. And so I'm hoping that in January we can see that our congressional members are responsive to that since it's something that we're seeing across the aisle.
And I would say that what's giving me hope is all of you. I was looking at the stats for the year end of Moms Rising, and guess what? We had double the action rate of last year, which is saying a lot because we had 82,000 GOTV, that's Get Out the Vote volunteers last year. We also helped pass a lot of policies that were really spectacular at the state level across the country. So even though we don't have things moving at the federal level because of the rising voices of the 1.2 million active members of Moms Rising all across the country, which is 1 in 300 people active in Moms Rising, we're seeing tremendous wins at the state level. We're also seeing candidates win who are talking about our policies. So when we just had these elections at the beginning of November, we saw a lot of candidates win who were talking about healthcare, talking about childcare, and then we saw voters propel them into office even if they weren't in Democratic strongholds. Because one thing that is really important to know is that these issues that we're talking about, the policies that we're talking about, healthcare that we're talking about, is bipartisan. When we go out across the country, it is not only Democrats that get sick people. Republicans get sick, independents get sick, libertarians get sick, Green Party gets sick. We all get sick at some point in our lives, and at some point in our lives, we all need health care. So right now, the Republican leaders in Congress and Donald Trump are absolutely out of step with their own Republican constituents. We're starting to see the tide change at the ballot box already. And because of your voice, your story, your persistence, even more people will know who is doing what, when, why, where, and how in our nation's capital, and then vote accordingly to make sure we have health care for all. So you as a movement, your persistence is giving me hope because we know that we can turn this around. We can make sure that everybody has access to health care. But what we can't do is give up. So thank you for being here. Thank you for not giving up. Thank you for all that you're doing. We're putting the actions in the box again. We have our first action, which is a text to call, people. Call your senators now. Tell them to pass an extension on the expiring Affordable Care Act healthcare tax credits. You'll see how to do that in the chat, but it's text ACA now to 888-418-5699. Action 2, write a letter to the editor. Congress is getting out of session and going to their home districts. And do you know what makes a big splash? When you read a letter to the editor in your home district, when you're at Christmas with your family and your family sees, why are you taking away our health care? Yes, important question. Let us put those in the local papers. Letters to the editor. We make it easy for you. There is a link. We make sure we automatically submit your letter to the editor to your local papers. It's super fun. And you can edit. We have a sample letter to the editor, but you can edit it. Action 3, hello, share your story. As you've heard in the news, members of Congress have access to healthcare coverage because they have health insurance through their jobs. A lot of people across the country do not. A lot of people across the country don't have as good of health insurance as they do. So let's give them a Get a Clue project about what it's really like to live in America right now when healthcare is under attack, and share your story at that link. Very important. Action 4, you can check out your healthcare coverage options at healthcare.gov. See what healthcare you can get now. If you need healthcare, it's not too late to get it. So thank you so much. Again, I want to thank Representatives Lauren Underwood. I want to thank our speakers, Marilyn and Sylvia, our interpreters, Mercado, the Moms Rising team, Jada, Catalina, and more. Thank you also, importantly, to all of you. And let's close with a round of applause, hearts, a lot of emojis of love, and some emojis of action, meaning lots of those confetti things. For you being here and for you persisting. And thank you to our speakers and the Moms Rising team and Geronimo and all the people as well. I'm so thankful to be in movement with all of you and not giving up. Nope, I'm not giving up. I'm fired up. I'm ready for 2026. I'm ready to go. So thank you. Thank you, Sylvia and Marilyn and everyone. Have a great night.